hear us now?
Yes.
Do we have anybody out there who has joined us? I see a couple eyes. Can anybody out there comment and let us know if you're there, if you hear us? Are we live? Welcome, welcome. Good afternoon. And we hope you can hear us. Um,
Good afternoon, everyone. Thank you for joining our live. We wanted to know if you could hear us before we start. Could you say yes on comments or no if you don't hear us?
yes, if they can't hear us, then I guess nobody will say anything. But you can also just give us a like or something like that so that we know we're not talking just to ourselves. Oh, thank you, Greg. Awesome. Thanks for joining and thanks for confirming we are live. Uh, Sorry, or thanks for your patience. Better said, it took us a few minutes to get things sorted, but we are here to share with you again about One Health and wildlife health.
Yes. So we are going to have some interesting presentations. We are also going to be sharing some 1-minute videos. We are also going to be having some updates and some quiz questions. So if you are listening, you're going to be able to answer these questions that we have for you. Are we going to be giving a t-shirt as a quiz?
Yes, we will announce the prize shortly. But yes, there will be a little prize for the winner as well. You won't become a millionaire, but we sure want to recognize any participants out there. But I think we wanted to start by talking about the poster contest.
Before we start, we wanted to introduce ourselves.
Oh, of course, yes.
So for those that don't know us, I am Aurora, and we have Dr. Isabelle on my side. So, yes. So like Dr. Isabel said, we have a poster contest that we wanted to share some updates with you. We wanted everyone and anyone to join and participate. We have some interesting prizes for the winners. And we wanted, Dr. Isabel, do you want to share some updates on the poster contest?
Yeah, so I believe we shared about it last time. Do we still have the little
Yes.
flyer for
So
it
we're
that we
gonna
can maybe
share
put on the screen?
we're
Because
gonna share the flyer with you guys so you can be able to see.
we have a little slogan on there. Unfortunately, that is too small for me to see without my glasses. But of course, the topic relates to One Health. And we want you to put on your creative hats on how you would depict One Health balancing human, animal, and environmental health, or why animal and environmental health matters to human health. If you want, we can give you some ideas as well. Or one topic that's always on my mind is traffic, traffic accidents impacting humans as well as animals, for example. And we hope to find or to receive contributions that give us catchy images to share this with the general public, to make these connections understood and maybe give us an idea of what we can do to balance health for all of us. Um, in order to make this all maybe a little more understood, we did want to share with you these 1-minute videos on One Health that we created to share with you some more of what all falls under this extremely broad, wide concept of One Health, what all the topics are under it, and these issues. And maybe we can of course, at any time here, if you have any questions, please post them in the chat, and we can respond right here, right now. But I think we should maybe share the first episode of our series of 1 minute on One Health that we prepared to try to make the topic a little more palatable and short.
IWT
Zero.
What
One
does it
and
mean?
These are zoonotic diseases
Human wildlife
that
collaboration using the
between
is very
so
common,
species diversity.
more so in the
Important factor
Is it
one is
in fact,
Okay.
genetic divergence
animal prevalence in health is
Find the website ambassador program if you have any color line 61
And if you forget anything else, line is 69 for your wildlife. Okay, so this one is done. This one is done. So we're gonna put scenes now.
Oh yeah, the sound. Are we back on the sound now?
That 1 minute was done.
We have to apologize, but the sound is garbled. I don't understand what happened there. So, that much for our plan to share another 10 of these 1 minute videos with you today. We may try this again and see if we run into the same problem again, but that is not how it should sound actually. Can we go to the YouTube channel from here and try that? Maybe that works better. So thanks for joining live as we learn technology, or not.
So yes. So this is our YouTube channel. You can follow. We have all these videos here. If you wish, you can please like, subscribe, and you can share, right, Dr. Ray? You can
Yes,
share.
yes.
You can share our videos. We have a lot of videos here, some 1 minute videos. They're all up here as well, and you can take your time and see them individually. You can listen to them, and if you have any questions, you can always reach out to us. But yeah, so you can reach out to us and send us your question, and we are going to be answering them. So Dr. Isabel is browsing through our YouTube channel, and you can also do that whenever you can.
Yes. The last ones, what did we have?
You can just press it then. Hit the go button.
Yeah. That's it. So let's try. We tried the first one, which was this one, correct? That's the one that you just played?
Yes.
So let's try what happens if we play it from here. No, it's not working. You can just hear us talking over it. So, next attempt. This did not work either. It's not working. So, next attempt. This did not work either.
Yes, so we do apologize for those technical difficulties. We're not sure why that is giving us trouble. We're learning. But you can, on your free time, you can check out our YouTube channel. We have different presentations that we have done and uploaded them there. We also have our 1-minute videos. It's just 1-minute videos, and you can, I'm pretty sure that you can listen to them. What else do you want us to? Um, Okay, so we're gonna have another presentation, and please let us know if you are able to hear us, and please do so on the comment.
Hello and welcome. Thank you for joining us today in another zoonosis talk, explaining once again why protecting animals and the environment ultimately protects yourself. Today we're going to try to get under your skin a little bit, and by popular demand, today's topic is mange and dermatophytes, or commonly called also ringworm. My name's Dr. Isabelle. So yeah, common zoonotic skin diseases. We are talking about two conditions today with mange and ringworm, and we're lumping them together because they both affect the skin, but they are indeed quite different. So as in all of our zoonosis talks, we're going to first present what are the causing agents of these diseases. Then we will talk about prevalence and how common these diseases are. We will briefly introduce what these diseases look like in animals, as well as what does it look like in humans. Then we will present how do we get it, how can we diagnose it and know that we have it, and of course, last but not least, and most importantly, how do we avoid getting this disease, talking about prevention, a little bit about treatment, and then in the very end, I have some resources for you for further information and guidance as well. So let's jump into it and reintroduce the One Health concept, which connects the health of humans to the health of our animals, both domestic as well as wild, and the shared environment between us all. And we do so because we realize that when we protect one, we actually protect them all. We wanted to remind you once again that zoonotic diseases are diseases that are shared between animals and people, and they can be transferred in both directions. And if you have seen some of our previous talks, then you may remember that more than half of the infections that humans get are actually spread between animals and people, aka zoonotic diseases. This is what makes these diseases so important, as well as animal health important to human health. So some general remarks first on these skin diseases and their connection to One Health. It is, first of all, very, very common to see signs of skin infections and lesions in our domestic animals as well as wildlife on intake. Skin infections are the most common infections in both animal as well as human medicine. The effects of these infections are very variable. So it can be just a simple irritation, and it can lead all the way to life-threatening conditions in some cases. Something that is important about both of these conditions is that both humans and animals can be infectious, meaning they can infect others without they themselves showing signs. And then, especially for the ringworm, the fungal stages, they can survive a long time in the environment. So some of those fungal and parasitic diseases can infect you and your children and cause severe zoonotic rashes. It is important to realize that these diseases can only be identified with the help of a complete examination and, in most cases, microscopy. So we cannot identify them just from the looks, even though there may be some more typical looks for one or the other. It always requires further diagnostic and a complete examination. So let's talk about causing agents. First of all, we have two diseases here, as mentioned. We have sarcoptic mange, also called scabies or sarna in Spanish, and there are other common names. This is caused by an acarid, which is a mite, and the family is Sarcoptes. The species is Sarcoptes scabiei. This is one species, but there is further research going on into potential genetic differences between them in different host species. Our second disease today, the so-called ringworm, is also in humans, sometimes called tinea, or the causing agents in general are classified as dermatophytes, which translates into skin fungi. It's in the class of fungi, and there are around 40 different species of dermatophytes. And common names involved here are Trichophyton, Microsporum, and Epidermophyton, for example. And here we have two images. Now here, this is the mite that causes sarcoptic mange, and then here we actually do not have images of the fungi, but we have images of the typical lesions here. Now, to how common is this? The prevalence for both of these diseases is very high. So it is very common. If we're talking about sarcoptic mange, it is very common in animals. It is actually described as one of the most commonly diagnosed skin diseases in dogs, that is, and it can infect a huge range of other species. So over 100 different species can become infected. Other species, aside dogs, that are very important to us as pets that infect humans frequently can be pocket pets as well. But of course, also wildlife species. In wildlife species, sarcoptic mange is causing more and more concerns, and it is often spread from domestic animals to wildlife. In humans, according to the World Health Organization website, there are an estimated 200 million people infected at one time with sarcoptic mange. And in certain poor areas, it's up to 10% of children that are suffering from scabies. However, in the environment, the prevalence is not as high for sarcoptic mites. That is because they are deep burrowing mites and they do not survive very long in the environment, thankfully. If we talk about ringworm, which is a fungus, this is worldwide very common, not just in animals, but also in humans. Extremely common, with estimates of up to 25% of the global population infected with skin fungi. It is also extremely common in domestic and wild animals. For both of these diseases, many species can be infected asymptomatically. What that means is they don't show any signs, yet they carry these disease agents. So we have here as examples for very common sources for us, dogs, cats, cows, sheep, but many wildlife species as well. And as opposed to sarcoptic mites, fungal stages are very resistant in the environment and can remain infectious for a next host for, here it was stated, between 12 and 20 months. So what does it look like in animals? Here is an example of one of our patients that was diagnosed with sarcoptic mange. This is a baby coati, already a few weeks into the disease, after treatment, with no more open sores, but a lot of hair loss, obvious. So in this case, this was not asymptomatic, but it had a lot of crusts, very hardened skin, scabs, and erosions that with treatment eventually resolved. And then another 4 to 6 weeks later, the little animal started regrowing hair with the elimination of these mites. So sarcoptic mange affects young animals as well as adult animals. It will affect immunocompromised animals or chronically ill wildlife more so than healthy animals. And very often sarcoptic mange is further complicated by secondary bacterial or fungal infections. It is very itchy in general, both in animals as well as humans. Sarcoptic mange can cause very, very severe itch. So ringworm in animals can again be without symptoms. Similar to mange, it will lead to hair loss, which in the case of ringworm can be circular, so the name of ringworm, these round lesions, but that is not always so. In most cases of fungal skin infections, these develop very slowly, so over the course of weeks, and they tend to cause a little less itch than our mite infestations. We can see a single lesion, we can also see multiple lesions, and this can also be generalized and be very, very serious at that point. So this affects, again, young animals more, but it can also affect adults, and similar to mange, or even more so, fungal infections affect immunocompromised animals much more so than healthy individuals. And again, similar to mange, fungal infections are often also complicated by bacterial and or parasitic infections. So how do we get it? 3 main ways, and this applies to both So in both scabies or ringworm, we can acquire this through direct contact with an infected human. So we do not just get this disease from animals, but we can also spread it from human to human. We can get it from an infected animal, like this little kitty here that has a little lesion on the face. And last but not least, especially so for fungal infections, we can acquire them from the environment. Because, as mentioned before, these fungal stages can remain infectious in the environment for up to 2 years. The mange mites, however, will only survive a short period of time in the environment, but they can also be spread, for example, with clippers that have contaminated skin from an infected animal from them. And then here we have this image of the foot. For example, athlete's foot is a skin fungus as well at cause for this condition. So how does this look in humans? There are very few images that I found on the World Health Organization and CDC websites. And this is where I got this description. What is typical, the first infection with scabies will generally take several weeks, 2 to actually 8 weeks, until the symptoms appear. Yet during this period, the person can already be infectious to other humans as well. So this is very contagious. When the second infection is acquired, this is usually symptomatic really quick. This is linked to the fact that the reaction and the symptoms that humans experience are actually linked to an allergic reaction, which takes some time to develop the first time around, but for a second infection, our immune system reacts much quicker. Scabies causes very severe itch. This is often even more so at night, and then we see these whelps and then pustules, as you can see in these pictures here. Similar to animals, because of the severe itch, the scratching will often cause secondary bacterial infections and fungal infections as well. Here's some images of ringworm in humans. It's described as a common fungal infection causing a circular rash shaped like a ring that is usually red and itchy. So ringworm too can be itchy, but it tends to be much less itchy than burrowing mites are. As mentioned before, it develops slowly. It can be a single lesion, but it can also develop into something like this. There are different locations depending on what parts are exposed. And again, similar to animals, immunocompromised humans are what's called predisposed. So if you develop a ringworm infection, it is also recommended to check with your doctor to ensure your immune system's health. So how do we know that we have it? We are not diagnosing any diseases through a presentation here, but this needs to be confirmed by a licensed veterinarian in animals and a medical doctor in humans. But in general, in animals, we use the clinical signs, the somewhat typical lesions, and then skin scrapings to identify either fungal stages or mites. We have to know that these tests can often be false negative, and one negative test result does not mean that the animal does not have these parasites. It is generally required to do these skin scrapings up to 3 to 5 times. And when it comes to skin fungi, we have an additional method here with the so-called wood slam that you see in this image here. About 50% of skin fungi may fluoresce in the wood lamp, and that's what you can see here. This is actually a tamandua mouth, the same one from the picture before, with this wood lamp showing very strong fluorescence all where we could before see the lesions on the mouth. In humans, it is similar that the clinical symptoms help to suspect this diagnosis, and then I have actually not heard of skin scrapings in humans. I assume they potentially should be done as well. And I just noted here, if you have itchy rashes on you and you're working with animals, remember to tell your physician that you've had contact with animals, to include this as a differential. There is a fungal culture to confirm fungal infections, but this is usually a slow-growing culture. So many times treatment will be instated before the fungal culture confirms the diagnosis. So most importantly, how do we prevent these diseases? Number one, keeping your pets healthy protects you, and keeping them on regular preventatives for mites so that they do not acquire these mites or maintain these mites and do not infect you. If you do see any lesions on your pets, we recommend cleaning them with a antiseptic and keeping them under close observation and having them checked by a veterinarian to make sure that your pets who may share close quarters with you do not carry these infectious diseases that you could get from them. We recommend using proper protective equipment, so wearing gloves when working with infected animals. And of course, we have to remember that they could be infected without showing signs. In humans, we just want to ensure that you are aware of these diseases, and especially for immune-compromised humans, the recommendation is actually to avoid contact if possible. There are some special recommendations and guidelines by the CDC as well for immunocompromised humans who may have a pet with either of these diseases that are linked down here. So it is recommended, as always, to wash your hands after touching animals. Another recommendation on the CDC website was to, for example, vacuum to remove skin flakes and other potentially infectious agents from your immediate environment, and or wearing shoes in contaminated environment. And there is a whole long list in these references. So a couple more CDC images here to remind you, always wash your hands after touching, feeding, or playing with your pets. Take your pet to the vet. That will help keep them healthy and happy, and it will keep you healthy as well. A little bit on treatments. So we cannot, again, prescribe treatments in a presentation like this, but it requires a veterinary or physician's examination to differentiate what is it that you are dealing with, because fungal, parasitic, and bacterial infections may have some semi-characteristic looks to them, but very often overlap, and they cannot be differentiated without these diagnostics mentioned before, aka microscopy or culture. And then there are different antifungal as well as antiparasitic treatments that will be prescribed, starting oftentimes with ointments and localized treatments. But when we have very severe progressed infections, then it may come to generalized infections and also systemic treatments. One last point here for fungal infections. In general, there are very long treatments because fungi develop slowly and the treatment also takes a long time. and it is often not completed, which then leads to reoccurrence. So here are some resources that were used and that we recommend for you to check into to find a little more information on keeping pets and people healthy, as well as CDC references on scabies and ringworm, as well as prevention and what to do if you have an infected pet. And then for veterinarians and other health professionals, we also very highly recommend the Companion Animal Parasite Council, which has guidelines on many parasitic diseases, including all of these zoonotic diseases, including these here. So please do not hesitate to send us any questions right now via chat, via email, and we look forward to hear from you and hope this helps you to stay safe. Thank you very much.
All right, so that was our presentation from Dr. Isabelle. I hope you were listening because we have some questions that we will be giving you, and then you're going to be answering those questions. And if you get it correctly, then we're going to let you know on the comments. You're also going to be winning a t-shirt. So yeah, if you answer correctly, you're going to do that. So we have here two interns that will be joining us that will be reading out the questions. We have Linda and we have Jen joining us today on our live. Thank you for joining us. Who will go first to read out the question? Okay, so we're going to have Linda saying the first question. So please listen, guys, and answer correctly.
So the first question would be, what type of infection is the most common in animals and humans?
Yeah. So we're gonna give some time for you to answer, and if you want us to repeat it over again, we can do so again. So do you want to?
What type of infection is the most common in animals and humans?
Please comment, guys. I hope Craig is still there and can answer our question.
We were also temporarily joined by Dr. Tessicum and
Oh, nice.
Ingrid Lima, who is a veterinarian and an animal health assistant. So I'm sure if they still hear us, they can answer.
Yeah.
And I would probably suggest to give the second question already. And then we give them a little bit of time to think about it and hopefully place it in the comments.
So yeah, we're gonna read out the other question.
So the other question is a little kind of two-parted. What are the two organisms that cause the two diseases that we talked about, scabies and ringworm? So what two organisms cause those, or type of organisms, I guess I should say.
Do you want to repeat it again, Michelle?
Okay,
but
so
slower.
So what type of organism causes each of the two diseases that were covered in the presentation? So what organism causes scabies and what type of organism causes ringworm? For example, is it a bacteria, a virus, a fungus, an insect? That sort of thing is what we're looking for.
Mm-hmm. And the other question?
The other question was, what type of infection is the most common in animals and humans?
Who's still with us and wants to win a t-shirt? Okay. Talk a little bit about program update, maybe?
So yeah, so while we give you time to answer our question, we are gonna be discussing a little bit about screwworm. As you may know, screwworm is already reported here in Belize, and we wanted to emphasize everyone that if you come across any worm, you can, if you have any doubt about being maggot or just another parasite, then please reach out to us or Baha, who is also available to assist you guys. So any worm that you may have doubt of, please reach out and we will be able to assist you. I'm gonna share the flyer from Baja that they have done, and maybe you guys can have a look at it. So so here are the flyers, and we're gonna give time for you to look at it and be familiar with this screwworm. We have the fly and the screwworm picture on one of the flyers. We also have open wound that shows how the screwworms are in that wound. So
We can give it a couple more minutes and see if anybody wants to comment still and comment today.
So has anyone been able to answer one of our questions? We're still waiting.
We have two new persons that just joined us now, but I'm sure they cannot answer the quiz questions because they did not see the video first. We can also, of course, we will share this recording and you will be able to comment in the recording as well. Because, yeah, I see we are being joined by a few more people right now, which is actually the minute that we will about stop live streaming. But as always, please do feel free to contact us with any questions, doubts, suggestions through the clinic email or phone number or WhatsApp. Rabies. Somebody is trying to answer rabies. Yes, that has very often been the answer, but no, you missed the presentation. I think you missed the question too. Do you want to repeat the question? Maybe we get a lucky guess.
Okay, so the first question was, what type of infection is the most common in animals and humans?
And it's not rabies.
And it's not rabies, no. But thank you for trying. Rabies is the answer to many dire questions. Yes, you've been in our trainings, I believe.
we also want to remind you guys about our Wildlife Ambassador program. We want to thank the Global Environmental Facility who has supported us, and we are now starting phase 2 of the program. And if you haven't heard about the Wildlife Ambassador program, Dr. Ray, do you want to talk about it?
Yeah, and the link is, you shared the link in this chat here as well, but, oops, but you can also find it on our website. And again, contact us via email or phone about it, because we're offering again the capacity building workshops that in person take 2 days. We have the program available mostly online as well. We have another conference coming up. We have, of course, we continue our normal services for imperiled wildlife and advice for people that have issues with wildlife, as well as other wildlife emergencies. And we will continue our regular posts on social media, Facebook and Instagram, as well as these monthly lives. And yeah, it's time to join us. We hope to reach more tour guides and teachers this time around, as well as continue to reach out to our protected areas managers and partners, and anybody who professionally or for their passion for conservation, of their passion for conservation, gets into regular contact with wildlife or wants to learn more how to protect wildlife and yourself. Our One Health that we share, and how to respond best in potential emergency situations, or how to recognize those. So that's the program in a nutshell. But I repeat, please contact us with questions. We want to offer about 20 more workshops countrywide over the next 16 months. And we are also developing further modules for training, and we are always open for your feedback and suggestions, what topics and diseases you would like to see us address. So that's the ambassador program in a nutshell. And one more repeat mention for the poster contest. So the One Health poster contest, where you can send us your creative ideas for a poster that shows this One Health concept, and maybe some ideas how to balance health between humans, animals, and environment, that we can then place on a poster and distribute countrywide. And there is small little prizes for it, including a small money prize for the chosen design in the end. And that's all I can think of in updates and what the program is about. So we hope to see you. We hope to hear from you. And did we get? We got another guess. Flu? No. Again, our presentation today actually covered fungal infections and mange, or in humans the disease is called scabies, as zoonotic diseases, so diseases that we humans and our common pets, as well as some wildlife species, share and can give each other. And that's what our quiz questions were relating to as well. So maybe you want to scroll back in the recording and watch the presentation on dermatophytes and scabies, or zoonosis getting under your skin, and you could try again. But the answers were neither rabies nor flu. But thank you very much for trying. We appreciate the comments.
So another reminder, we're going to be having one live per month. So we are going to be updating you, so you can follow us on our Facebook to get these monthly live updates. So thank you guys for joining us today. We do apologize for technical difficulties, and we hope to have you here in March, because we're not sure which day in March, but we're going to be announcing our live. Thank you again, and we hope to see you. Have a safe and happy rest of the week. Thank you, guys.
Thank
Bye-bye.
you.